are some big renal stones with more than 2–2.5 centimeters of diameter, or renal stones that occupy a big part of the renal cavities, causing obstruction to the urinary flow. This kind of stones can cause also pain and infection with high fever. There are 4 main steps in order to perform PCNL. First, percutaneous access to the renal cavity. Second, dilation of the percutaneous tract. Third, stone removal. And fourth, renal drainage. Let's see the first step. We have to perform a puncture of a kidney calyx, that is a part of the renal cavities that contain the stone. And secondly, we have to secure this access with the placement of a guide wire. You can see now how the procedure is performed. And this is the fluoroscopic X-ray control. The second step consists of the dilatation of the percutaneous tract in order to create an adequate space for the introduction of our instruments into the kidney. You can see a dilatation of a percutaneous tract using a balloon. In this case, you can see a dilatation of a percutaneous tract using the Amplatz facial dilators. We then introduce a special endoscopic instrument that helps us see inside the kidney. We then proceed with the stone fragmentation and removal. By introducing special probes into the nephroscope, we can perform lithotomy, that means stone fragmentation. There are different types of energy applied for lithotomy. You can see now a ballistic lithotomy. The probe uses the mechanical energy of compressed air in order to perform the stone fragmentation. Litholapaxy is the process of mechanical removal of residual stone fragments using special forceps. Observe now the final result with the renal cavities free of stones. The final step of the procedure is the renal drainage by means of a small nephrostomy tube for 1 or 2 days. Percutaneous nephro lithotomy is a valid, minimally-invasive procedure. By means of a very small surgical incision and with minimal renal trauma, we are able to remove big and complex renal stones, avoiding major surgery.